Hello and welcome. Bombs, gunfire and missile attacks have taken a terrible toll on thousands of Palestinian children caught in the middle of the long-running conflict with Israel. For the hundreds badly wounded every year, the prospect of medical treatment is seriously hampered by the poverty and lack of medical resources in the embattled Palestinian territories. In an effort to address the medical and humanitarian crisis that rules these young lives, the Palestinian Children's Relief Fund was established in 1991. Since then, it has expanded to help suffering children in other Middle Eastern nations, improve the quality of medical care by sending in equipment and supplies into the West Bank and Gaza Strip, and training Palestinian surgeons. The PCRF currently has several sick or injured Arab children in the Middle East, Europe and the US whose medical treatment is being covered for free. Today we speak to the founder of this organization and meet a doctor who's volunteering his time and skills to help improve the lives of affected children. You can join us with your questions and comments. Joining me today from Cleveland, Ohio, is one of the founders of the Palestinian Children's Relief Fund, Steve Sosebee. And from Oakland in California, we're joined by Dr. Ziad Sabah, a pediatric cardiologist at the Children's Hospital in Oakland. He regularly travels to the Middle East to volunteer his time in helping Palestinian children in need of medical treatment. Gentlemen, I welcome you both to the show.
Hello.
Hi. Steve, if I can start with you and ask what you see as the biggest challenge you face in getting treatment for these young children who desperately need it, of course. Is it simply a matter of resources?
Well, it is indeed resources to some extent. I think right now the situation is logistics as well. I mean, in Gaza you have a 1.5 million people living under siege and who are under basically living in a large prison, and their access to health care outside of Gaza, you know, the resources in the Gaza Strip are very limited as far as hospitals and services that can be provided. Getting these people out for specialized care, which many of them need as a result of the trauma that they're exposed to, or just through normal healthcare needs with diabetes or heart disease or what have you, getting them treatment that outside of the country is extremely difficult. For example, the #1 killer of Palestinians in Gaza, the 1.5 million people in Gaza, is heart disease. Yet there isn't a single cardiac surgery program in the Gaza Strip. So the hundreds and thousands of people, children and adults, every year who have heart disease are unable to travel to hospitals in Egypt, in the West Bank, where there is a cardiac surgery program, in Israel for open heart surgery. They simply die. So it is a matter of resources, because we would be able to build, or should be able to build, a cardiac surgery program in Gaza. If people were able to go outside for training, if we could get equipment into the Gaza Strip, if doctors could come in there freely without fear and without having their access prevented, and also the logistics of getting patients out for treatment to centers which exist in the region, but which they're unable for reasons which are being imposed upon them, the limited access to traveling abroad. Those are the two main factors that are really affecting the ability of Palestinians, and it's almost the same in the West Bank, not quite, but almost the same there as well. The inability of people to travel for treatment, the lack of resources for treatment to be arranged abroad, and the difficulty within the local healthcare system and the public healthcare sector in particular in providing adequate services at a high standard, which which Palestinian patients deserve.
Well, let me bring in Dr. Ziad Sabah now and say thank you for joining us here, and ask you, what made you get involved with this project in the first place? What made you want to, and you travel out regularly to the region to help these young people in need. What made you get involved in the first place?
Yeah. The first time I went there, it was in 1999, and it was, things were settling down. They were not as active in terms of the violence, but you feel like this urge. You're an Arab American, you've graduated, you're spending your time in the U.S., you have a nice, comfortable lifestyle. It's a nice opportunity to give back. It's a nice endeavor, and so I heard about it through a friend, and my wife and I went the first time in 1999 before we had kids, and after we had kids, it was difficult for my wife to go, so I was going by myself almost yearly since then.
Now, what sort of conditions do you have to work in out there when you're in places like Gaza and Ramallah, where, of course, you face the issue of interrupted power supplies, you have limited medical supplies reaching you on a regular basis? What sort of difficulties have you found out there personally?
Yeah, that's one of the refreshing things. Things have improved so much with the system that we have, and we've been doing it for 7 or 8 years now. Initially, you would go there, you have no idea what to expect, but as we built relationships with the local surgeons and the local cardiologists, then you know what to expect. And most of the time, every time I come, I bring in donations. I actually talk about the cases with the local surgeons, so I have some expectations so we don't have surprises. There have been some exciting times in 2001, 2002 when we had bullets and stuff, and you'd have to it was not that comfortable, but overall that's what's refreshing is the system has improved, and I feel great about now we almost have a nucleus of a program in Palestine that may be independent at one point.
Steve, tell me about the tragically sad story of Assad Mahmud, who you managed to get out of Gaza so he could get medical treatment for his intense injuries in Philadelphia.
Yeah, Assad is a 15-year-old boy from the Gaza village of Beit Hanun, which is in the northeastern part of the Gaza Strip, and it's on the basic front line of the conflict between those who are firing rockets into Israel, into the Israeli town of Sderot, and the response or the provocation by the Israeli Defense Forces in trying to prevent these rockets from being fired. In between those two forces is a civilian population, and among that civilian population is a large number of children. And Assad is a 15-year-old boy who was playing soccer in the street with his friends one afternoon last September, when he was hit by an Israeli missile which was fired from a tank, we believe, and which caused a large amount of carnage in the sense that 4 or 5 of his friends were killed, and Assad himself lost 3 of his limbs. He lost 1 leg above the knee, another leg below the knee, and his left arm at the shoulder. And so he's a triple amputee, a child. His whole life is in front of him, and the quality of prosthetic care in Gaza and in Palestine in general is very poor. So our organization came to know about his case. We have field workers on the ground. We know of most of the injured children in Palestine who need care abroad. And we put him into a program where we arranged treatment for him for free in Philadelphia at the Shriners Hospital. And a couple of months ago, he came over with his mother. But before we were able to get him here, it took us 4 or 5 months of getting Assad and his mother, as well as several other injured children, out of the Gaza Strip. They were denied passage by the Israelis, and then they were permitted by the Israelis, and they were denied passage by the Egyptian government as well. As you know, the border between Rafah and the southern Gaza Strip and the Egyptian crossing into the Sinai and thus into Egypt proper has been closed by the Egyptian authorities, closed by the Israelis. It had European monitors who have left when the Hamas government came into power last summer, and as a result, basically people are imprisoned there. And even for humanitarian cases like Assad, here's a 15-year-old boy who lost 3 limbs. He's not a security threat to anyone. He's a humanitarian case. Even these type of children are being denied access to healthcare providers outside. Right. We worked hard in trying to get him permission to leave. Eventually, the Egyptians agreed to allow him to cross, but it took several months, and several months of this boy suffering in a wheelchair, several months of the other children who are injured. 1 girl was blinded, another child also was missing a limb, another child needed severe orthopedic surgery. So these children were basically suffering. Assad is one of them, suffering needlessly, waiting to get permission simply to cross into Egypt as a transit point to come to the United States for treatment, which was arranged for free by our organization with American doctors and American hospitals who are willing to donate their time and services. So it really is a tragedy, not only that Assad had to suffer this, this injury which will affect him the rest of his life. You don't grow limbs back. You can't transplant legs. You can build artificial legs, but those are, not really the same thing. Right. Not only is he suffering this the rest of his life, but just the injustice of having to sit every day waiting to cross, really. Right. It's common, and unfortunately Assad is an example of hundreds of kids and hundreds of other people in Gaza and other parts of Palestine who are suffering the same type of restrictions, not only imposed by the Israelis. The Israelis actually in this case were ready to let him cross. In this case, the Egyptians that didn't allow him to cross, and eventually with the kind help of the Egyptian consulate in New York, who worked hard on us, on helping us to arrange for him to cross, they were eventually allowed. Yeah. But I guess in that sense they were fortunate, because there's many, many other kids there who need treatment abroad who are also stuck and can't cross out of Gaza.
Let me ask you, let me ask you, Dr. Sabah, I know you specialize in cardiology, but let me ask you about the kind of conditions you end up in, the severity of some of the conditions you encounter when you're in the Palestinian territories, for example. I know, for example, many of the kids there's a large number of kids suffering heart conditions there.
Yeah, and unfortunately, what you see the people who make it through the acute stage. I am sure heart disease is something you're born with, and a lot of those babies don't make it till the time that we get to see them in the clinic. And so we're seeing only a small spectrum of the disease in this area. It's very unfortunate. The next step, I would imagine, is the ability to diagnose those patients early on at birth so that they're referred quickly. And I think we're making some progress in the West Bank. It's a much harder case in Gaza.
Steve, tell me a little bit about because I know you treat a lot of the children. Obviously, you try and get so many outside the country, and you've managed about, I think, 800 in since you've launched the fund. It's been what, 18 years or 17 years. But tell me about the treatment you do on site, so to speak. Like you have the large center in East Jerusalem. What do you focus on there?
Well, basically, we're working within the existing Palestinian healthcare infrastructure. Hospitals, they have decent hospitals in Palestine. A lot of money has been spent by international donors, particularly in the Gulf and by the European Union, to upgrade the quality of healthcare infrastructure in the West Bank and also in the Gaza Strip. The problem is that there are not a lot of highly specialized physicians working there, although there's many good, hard-working surgeons and physicians working in Palestine. I'm not saying that. But in some of the subspecialties, like open heart surgery for babies, they simply don't have these specialties. It's a very rare specialty even in the developed countries. So unfortunately, what is going on there is that a lot of the patients aren't getting treatment. So we're bringing in specialists like Dr. Saba and others in various subspecialties that don't exist in Palestine. For example, the open heart surgery program. We bring in teams from outside, volunteer teams from Europe or North America, Australia, New Zealand. They come in as volunteers. They work for whatever amount of time they can donate. They do treatment and operate on children or diagnose children or provide their services on a volunteer basis. And at the same time, they're providing training and exposure and experience for the local healthcare professionals. And we've been working this year alone in 2008, it's only half over. We've already sent nearly 40 missions to Palestine and to Lebanon, including open heart surgery for children, orthopedic surgery for children, eye surgery, plastic and reconstructive surgery. There's hundreds of kids who are burned in Palestine or who are born with facial deformities. We treat them for free. General pediatric surgery, and so many different areas, so many different subspecialties, urology, vascular surgery. These are things which our organization finds these volunteers who are very qualified, hardworking, dedicated humanitarian physicians like Dr. Saba and others who are willing to volunteer their time and go into areas in some cases which are very dangerous. We had a French team and a Swiss team last month in the Gaza Strip working at a time when, you know, there were incursions, there was a lot of infighting between Hamas and Fatah and people caught in the crossfire. The Israelis were continuing their incursions and so on. So we have these doctors who are willing to put aside their own personal safety to go in to provide these humanitarian services for people in need, because our focus is really trying to reach the people. We don't care about Hamas and Fatah. We don't care about these issues. Our sense of urgency is for the population, the civilian population, and in particular the marginalized children, and providing them the healthcare services that they need, which they're not getting. Right.
Well, I'm going to just, before we take a break, get Hani on the line from Saudi Arabia. He has a question or comment. Hani, very briefly, what would you like to contribute?
Yes, hello, hi, my name is Hani. I would like to hello?
Yeah, go ahead, Hani.
Yes, hi, I would like to know how can I make a donation?
Okay, Hani,
especially for the kids, you know, for the
what I'm going to do,
kids.
Hani, I'm going to get to that as soon as we return from this break. We'll get to answer your question and take many more. Stay with us.